This is Health Call Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the Health Call Radio Hour, now heard on more stations around the country as they join the Health Call Radio Network. Well, just a couple of things in life are certain. That you always hear about death and taxes, but also that as you age, your body's output of hormones is simply going to decline. It's really hard to escape it, but that doesn't mean that you have to live in a state of hormone deficiency. So that's where we're going to start today with our good friend Greg Russell, founder of Fort Wayne Custom RX. And also joining us today is Paula Heil, his women's health specialist. She's a registered nurse. So, guys, thanks for joining us today.
Great to be here.
Thank you, Lee.
You bet. Paula, I want to start with you. Tell me, what are some signs and symptoms that maybe it's time for me to be thinking about some hormone therapy?
So typically what we're going to see initially is going to be hot flashes, night sweats, sometimes a decrease in libido, and vaginal dryness. Those are the big ones that we usually see.
And women come to you starting at what age? Is it pretty consistent or is it sort of all over the board?
It's kind of all over the board, but mostly we're going to be seeing those women that are going to be menopausal. So usually from the time they stop cycling, usually the first few years is when we're going to see them. Sometimes it might be later, but typically the first few years of menopause.
And Greg, one of the things that I know your pharmacy does is specialize in custom compounded components. I've used a testosterone supplement that you prepare for me for several years now. And explain to us that process of how you mix and prepare these supplements and why the custom process is, you think, so important.
Yeah, well, thanks, Lee. Well, first of all, all of the compounds that we do are trying to replace the natural hormones that you make. So in other words, for a male, we're going to give testosterone, and for a female, we're going to give a form of estrogen. It could be estradiol or it could be estriol. They do have some differences in what they do, or progesterone. In fact, we love to give progesterone with estrogen because they're kind of a yin yang. They kind of need both of them to work most efficiently. So our products are not the patented drugs. These are hormones. They are not FDA approved products. However, they are USP recognized chemicals or hormones that we can compound with. It's legal to do that, of course, with a prescription from a physician.
Mm-hmm.
So what we do is we try to work in combination with physicians to start with dosing. And usually, and Paula can go into this more detail, usually we start with lower dosing and we work up over time to try to alleviate those symptoms. And basically what we're trying to do is we're not trying to give you a hormone to make you an 18-year-old again. We're trying to give you the hormones that you need for this phase of your life. And the big three things we always love hormones for is the brain, the bone, and the heart. And that's, to us, very proven that we need those hormones for those effects.
I just want to make clear that, we threw out the phrase bioidentical, and explain to me what that really means, because I think people are a little confused about that.
Very, very, very good point. Bioidentical actually is kind of a phrase that I personally rather use the word natural hormone replacement.
Okay.
In other words, as you age, you get low on estradiol. Well, then we want to replace estradiol. We don't want to give you a synthetic estrogen like you might find in a birth control pill or in something like a knockoff analog of that hormone. And the reason for that is they use analog hormones so that they can patent them and they can make them more potent or specific at a certain receptor. So they do more of a specific activity. But what we try to do is we're trying to just replenish what your body has already used. So in other words, I'm going to get a different dose of testosterone than Paula would obviously, because I'm male. So she's going to get a different dose of estrogen than I would. But the point is, for our normal functioning, we kind of know how much of those hormones we need to help us have the best quality of life that we can have.
I'm not sure people understand that some of the most common prepared pharmaceutical versions of hormones actually aren't human at all. Paula, tell me where they come from and do you know how they're made?
So some are going to be synthetic, which, obviously has to be altered in a lab. Some may come from an animal source. Typically, animals are going to have different kinds of estrogens than we would have as women. Um, that's going to be the two primary differences between a synthetic and a bioidentical or a natural.
And those animal sources are often pregnant horses. So,
Right. Premarin is pregnant mare's urine. Is
yeah,
where that came from, that name.
I'm sure people kind of may not know that and are kind of surprised to hear that.
Yeah.
You know what? And they may also be surprised, Greg, to hear what you just mentioned, testosterone for women. That's an important element that also goes missing, right?
That is true. Most of our males are getting about 50 milligrams to 100 milligrams of testosterone replaced. A female is going to get somewhere between half a milligram to 2.5 milligrams typically replaced per day. And there's different forms of it. For the men, we might use injections. For women, we don't do injections. Um, we typically use creams. And there's troches, and a troche is a hormone that dissolves in your mouth. There's things like suppositories, vaginal suppositories, and vaginal creams and topical creams. There's just all kinds of different dosage forms for depending on the effect that we need to do.
And what is the effect that testosterone has on women? Why would a woman need testosterone?
Well, as a woman ages and her ovaries start to not produce testosterone, which is where the testosterone produced, they're also produced in the adrenals. So we have to kind of consider all sources. So testosterone has a real important effect on bone health and heart health. So testosterone is what we call an anabolic hormone. It's done to build muscle and bone. And so the bones are that pretty much we're concerned about, osteoporosis, but we're also concerned about the heart muscle, heart health, because the number one cause of death still in females is heart disease. Hands
So,
down.
Paula, in your role is working with women in what way? Are you discussing how the mixture is performing? Are you discussing kind of what is that conversation that you have?
So in education, what I do is I explain what each hormone is to start with. So the estrogens, the progesterone, and testosterone, I will explain each one of those, what the role is, and we look at what potential symptoms that patient may be exhibiting, and then of course we'll discuss the options. Now the doctor is going to be the one writing the prescription. So we'll discuss maybe what that patient needs. I answer any questions, and then we go from there. So what we see a lot, especially in menopausal women, is going to be the estrogen, progesterone, and sometimes testosterone if they have if the ovaries are not producing any or enough, because the ovaries produce about 45 to 50%. So those women may benefit based off of their symptoms and their levels. They may benefit from testosterone as well.
So women come back to you and as they're on these products, and what are they reporting to you, and how does that information that they're sharing with you maybe change how you might walk the patient forward?
So again, we're going to be looking at their lab values. We're going to be looking at their symptoms. We try to recommend the lowest dose possible to control those symptoms. And if they're doing great, maybe they don't need an adjustment, and the doctor can continue what they're on. But if, maybe their symptoms aren't getting any better, and that may be reflected by their lab values, then we might need to make a change in their dosages.
And then how soon after you start making those adjustments do I see or feel the benefits or effects of that change?
Yeah, so with the estrogen and progesterone seems to work a lot faster than testosterone. So, women can see difference within days of hot flashes and night sweats. As far as, the estrogen, progesterone, the same thing. Now, testosterone, that's going to take usually 8 to 12 weeks for those symptoms to improve, or those lab values to improve. So, I like to follow up in a month and see how they're doing. Some of the lab values, though, you may not need to repeat those that soon. You might want to wait a little while on those. Some of the lab values, they do have to be repeated routinely, to make sure that patients, not getting too much, or getting enough, obviously.
And Greg, we've talked about bone and heart and other things, but there are some, I don't know how to phrase it, I guess, psychological benefits to this as well. I guess I'm thinking more in terms of cognition and mood. So tell me about that.
Yeah, so definitely estrogen and testosterone, as well as progesterone. Progesterone is kind of it's the feel good hormone for women. So
Mm.
progesterone, when they're low, they may feel anxious, um, and so progesterone has a natural relaxant for the brain, kind of a break for the brain. When you're constantly thinking and worrying about things, progesterone kind of helps put that break on that. Estrogen for women is very important. It helps them with anxiety. It helps with depression. If they're low in estrogen, they may feel depressed. Estrogen also just helps them. My wife can multitask. I cannot. It's because she has an estrogen brain and I have a testosterone brain. So that's the best way. I think everybody would understand that, in the show. I can't multitask worth a darn, but she can. And so that's estrogen's effect on the brain. So as you can imagine, as you age and you have less estrogen and you become more frustrated because you can't multitask, that's a quality of life issue.
Yeah, I'm just laughing there, Greg, because I'm right there with you. My wife is so much better at that multitasking thing. It's hormonal. That's what I will say now,
It's
right?
Hmm.
hormonal to a certain degree, yes.
Oh, that's good. That's great. What about the concerns of cancer? We go back to the Women's Health Initiative study and this headlines all over the place linking hormone therapy to cancer is I think that study's been pretty well discredited, but is there still some of that lingering fear?
So what's interesting about that Women's Health Initiative study, that study when it came out showed that estrogen alone did not increase cancer, which was was one shock. But they said when estrogen was combined with a synthetic progesterone called a progestin, medroxyprogesterone, which works the opposite of progesterone typically. But when that was used in combination, it really did increase cancer rates, breast and uterine cancer. So it's interesting. There are some different studies that have been out in Finland. They did a giant study that because they have socialized medicine, they were able to track women over the course of a decade, and like 1 million women, and they were
Mhm.
able to show that actually using hormone therapy did not increase cancer rates. Having said that all, it is commonly accepted that estrogen can cause cancer because it causes cells to divide. It's a growth hormone. So we always like to give progesterone in balance with estrogen. That minimizes potential chance of any cancer. And we try to use the lowest dose we can use of estrogen.
Mhm.
So that's why we like to test, and we start low and we go slow, and we don't want to throw somebody into a problem.
Sure, sure. And Paula, is this something that I'm going to be on? Am I safe to be on this into my 70s, 80s, and beyond? Should I think about that?
Well, from what we know, 5 to 10 years after menopause is going to be the time that's going to give the protection for the bone, the heart, and the brain. So we know at least 5 to 10 years. There is a lot of doctors that work in anti-aging and integrative therapy that will keep women on it longer because they may feel better. So it
Hmm.
just depends on the practitioner and the patient, and obviously follow up appointments, making sure that your levels are still in the ranges that they should be. Symptom control; those are all things that the provider or the doctor is going to be taking into consideration. In order to know if they want to leave those women on them. But there's literature that shows women can take low doses longer than the 5 to 10 years.
So walk me through the sequence, the process. If I think that I want to learn more about hormone replacement therapy, um, do I start with my doctor? Do I start coming to talk to you, Paula? Where does that process begin?
So obviously, your practitioners are very important in that triad, of care. But the issue is most practitioners don't have time to sit down with their patients and discuss
Mhm.
with them 30 to 45 minutes of what they can get through a pharmacy like us. So they can contact us. I schedule my consultations. I schedule Greg's consultations for men. So they can always call me. Basic questions I can answer over the phone. A consultation typically is going to be longer. We do have a fee for those, but when women come in and sit down, we're going to give them all the information that they need to, guide them to what's going to be best for them.
And if I'm currently taking a commercially prepared pharmaceutical product and I want to shift, how does that process work?
Well, it depends. It's going to depend on the actual product itself. So, for example, if it's a patch that you've been on, we probably would not recommend you come off the patch because you're going to find you could be pretty stabilized on the patch. Now, there
Hmm.
are some bioidentical or natural hormone patches out there, and those are commercially available, and they do work for many patients. Um, the benefit of our product is it's more flexible, so we can adjust the dosing a little bit more. We still have a little bit more of adjusting that we can do, but if people are stabilized on a commercial estradiol patch, we're not going to recommend they pull that off and start with our
Yeah.
product right away. If not, they're going to be miserable. The hot flashes are going to come back.
Oh,
As-
okay, I get it.
yeah. But
And
for
if
male, for let's say a male testosterone androgel type product, which is very expensive and people's insurances don't always cover it, then that's a different story. We can work with the doctor and the patient on that.
and then where do I go to get my values checked? Is that something I do through my doctor, or can I do that with you?
So the doctor can order blood tests for all those hormones, and they can get those drawn at any lab. Also, there is saliva testing. There's multiple companies across the United States that look at all the hormones in saliva, and they're very accurate. Now, that's a kit that they would have to pick up from us, and obviously, we would have to tell them what they need checked. But
Hmm.
that also is a possibility. Those are typically not covered by insurance, but the price is not that bad. So I think most people can afford it.
The saliva has the additional advantage of having some breakdown products, the breakdown metabolite products that we're able to see. They divide out the different types of estrogens, for example. So there's some advantage to that. However, for many people, we can do it with blood too. In other words, the regular lab.
Okay. Um, there are, if I want to look at supporting my system, are there any nutritional products that I can use either on supplements or without supplements?
Sure, absolutely. So commonly we use some products that contain a cruciferous vegetable breakdown product called diindolamine methane, or DIM is what we call it. And we like
Hmm.
that even if we put patients on estrogens. Remember we talked about estrogen and cancer. The thought is that these products work in the liver and they block the breakdown of estrogen into the products that cause cancer.
Hmm.
So we use that in both men and women. We like to use it in men that have risk for prostate cancer, for example, and for women, of course, be breast and uterine cancer. Those products are available over the counter, and many times we'll use them alone if we think someone has what we call estrogen dominance. And that would be a woman that has estrogen overload symptoms like fluid retention, um, breast tenderness, some other symptoms that um, usually are swelling of the ankles and limbs and things of that nature. Or, we get their estrogen levels back and they're high. So in those cases, we don't want estrogen too high. We'll use that type of a product to break them down. But we can use them in combination or by themselves too.
Well, Paula, I'm going to give you the last word here. What do you want people to know if they are thinking about maybe it's time to take a look at what's going on with my hormone levels?
Well, I would say knowledge is power. And I think that the more information that women have, the better choices that they can make for their individual health care.
And I guess the place to do that is to visit Fort Wayne Custom RX at 425 East DuPont Road, schedule some time with Paula or Greg, and have a conversation about hormones. Guys, thanks very much.
Thank
Thank
you.
you.